Okay, welcome back. We're going to be looking at the muscles of the lower extremity, and we're going to go over the muscles, some origin, insertions, and actions. You may need to refer back to the other video that has me performing what the actions look like of the lower extremity. So let's start with the anterior hip and hip muscles. Here's the iliac crest. On the inside of the iliac crest is the muscle on the iliac fossa called the iliacus. What this model isn't showing, it's not showing the lumbar spine, and what would attach to the lumbar vertebrae, L1, 2, 3, 4, 5, the vertebral bodies and the discs would be the Psoas Major. So the Psoas Major muscle and the iliacus muscle combining creates a muscle known as the iliopsoas. That's your primary hip flexor. It inserts on a lesser trochanter. So the primary hip flexor antagonistic muscle would be a muscle on the back called the gluteus maximus. That's your primary hip extensor. If we go back to the front, here's the iliac crest. Right in the front is the ASIS, anterior superior iliac spine. There are two muscles that originate there. One is the TFL, Tensor Fascia Latae, call it the Starbucks muscle, Tensor Fascia Latae, and then the Sartorius muscle, the longest muscle in the body. The Sartorius is the most superficial muscle of the anterior thigh. It actually is superficial to the quadricep muscles. It goes from the ASIS. If we follow it down, the insertion is just medial to the tibial tuberosity. There's the tibial tubercle or tuberosity, and medial to it is an area, an attachment called the pes anserine. It means goosefoot. The Sartorius muscle we refer to as the Faber muscle, F-A-B-E-R. It flexes, it abducts, and externally rotates. Faber, flexion, abduction, ER, external rotation. It's known as the Patellar muscle as well, or the figure 4 muscle. That's the position it looks like when you cross your legs. Here's the Tensor Fascia Lata. It originates on the ASIS and the front of the iliac crest. And if you look at the insertion, it inserts on this band right here, or this tract, known as the ilio, because it originates on the ilium, tibial, because it inserts on the tibia, the iliotibial band. And the TFL is an abductor of the hip, and it can also internally rotate the hip. Now we're looking at the front of the thigh, where we have 4 muscles known as the quadricep muscles. Quad means 4. 3 of them are the vastus sisters. We have a medial one, a lateral one, and one between, intermediately between the two. We refer to them as the vastus medialis, the vastus lateralis, and the vastus intermedius. So those are the vastus sisters. Vastus medialis, vastus lateralis, and vastus intermedius. All 3 of these originate on the femur. They cross over the patella and attach to the tibial tubercle. The one that's the most superficial is going to be the rectus femoris. The rectus femoris crosses the knee joint just like the other 3, but this one originates on the AIIS, the anterior inferior iliac spine. So this is the only quadricep muscle that, since it crosses the hip, it acts on the hip. It can flex the hip joint as well. It's a weak hip flexor, but it can flex the hip. Now I want to point out something interesting here. We're going to look at these 2 soft tissue structures from a structural perspective and a functional perspective. By a structural perspective only, when a soft tissue structure goes from a bone, from one bone to another bone, we call it a ligament. When a soft tissue structure goes from a muscle to a bone, we call it a tendon. So if we look here at the quadriceps going from here, from these 3 muscles to this bone, that would be called the patellar tendon. But when it crosses over the patella, when it goes from this bone to this bone, we call it the patellar ligament. Bone to bone is a ligament. That's from a structural perspective. However, from a functional perspective, since this contracts and shortens and there's tension that's being generated here, it can be called a tendon, but we have to specify and say infrapatellar tendon. So that's the patellar tendon above it. Below it is the infrapatellar tendon. In young teenagers, when the quadriceps become very strong and pull and pull and pull and tug, it tugs on the tibial tuberosity, causing almost like an avulsion of it where it pulls away, called Osgood-Schlatters disease. Okay, that's the quadricep muscles. When we turn it around, there's the gluteus maximus, your primary hip extensor. It too inserts on the ITB. When we pull away and dissect the gluteus maximus, we could see gluteus medius. Deep to the medius would be minimus. Medius and minimus are your hip abductors. Below that, or inferior to it, we see a muscle called the piriformis. It's a primary, a very important external rotator. You can see the sciatic nerve piercing inferior to it. In a certain percentage of the population, around 15% of it, it can pierce through the piriformis. And when the piriformis muscle is in spasm, it can interfere with the sciatic nerve, creating a form of sciatica known as piriformis syndrome. On the posterior thigh, we have 3 hamstrings. We have the semibrothers. On the medial aspect are the semitendinosus, which is more superficial, and deeper to it is the semimembranosus. If you get a good view of that, here's membranosus, and here's tendinosus. If you follow the tendinosus, you'll see that it inserts at the same place as did the sartorius on that area called the pes anserine. The third muscle that attaches on the same area as the pes anserine is the most medial muscle of the thigh. That's an adductor called the gracilis. It's the second longest muscle in the body. So the sartorius, the gracilis, and the semitendinosus all insert on the pes anserine. The lateral hamstring is the bicep femoris. It inserts on the head of the fibula. All hamstrings originate on the ischial tuberosity. Your hamstrings primarily flex the leg. They flex the knee, but since it crosses the hip, it can also extend the hip. On the back of the calf, we have the gastrocnemius. The gastrocnemius has a medial head and a lateral head. First, identify what we're looking at. So here's the pinky toe. That's the lateral side of the leg. So that's the lateral head of the gastroc, medial head of the gastroc. Notice that it attaches to the calcaneus by way of the Achilles tendon or calcaneal tendon. But there's 2 other muscles that contribute to that Achilles tendon, and that would be the soleus, the large muscle, and the plantaris. The plantaris is mostly a tendon that you see here, but the belly of the muscle crosses the knee joint. So the gastrocnemius, then you've got the plantaris, and deep to that is the soleus. Those are all plantar flexors. They all make up the Achilles tendon, and it attaches to the calcaneus. When I rotate this to the front, we have the tibialis anterior muscle. It's the large muscle of the anterior shin. It dorsiflexes and inverts the foot. It's innervated by the deep peroneal nerve, and when it's damaged, people can get foot drop, and it's associated with a gait called steppage gait. On the outside of the leg, I just wanted to point out there's a lateral compartment as well called the peroneus sisters. There's a peroneus longus muscle that goes underneath the foot, and a peroneus brevis that stays lateral and attaches to the base of the 5th metatarsal. These peroneus muscles evert the foot, whereas your tibialis anterior, besides dorsiflexing, can invert the foot, bringing the sole of the foot in inversion. So you have an anterior compartment, a lateral compartment, which is peroneus longus and brevis, and a posterior compartment, which is the gastroc, soleus, and plantaris. So that brings a close. One last thing is underneath the foot, we have muscles that contribute to the arch, and one of the main structures that contributes to the arch is called the plantar fascia. And if it's hypertonic, it gives you high arches. If it's flat, low arches. So it either gives you pes cavus or pes planus.